I'm doing my presentation on the potential use of teat sealant for subclinical and clinical mastitis prevention in heifers. So, to start out, let's clarify some terms. Let's first talk about mastitis. Mastitis is a bacterial infection in the mammary tissue that causes pain and inflammation. It can occur when any bacteria enters the teat canal. However, it is usually caused by the spread of staph, strep, or coliforms. Obviously, different strains of them. Mastitis infections can be clinical with apparent signs like udder swelling or redness and abnormal or chunky milk. However, heifers, just like lactating cows, can also contract mastitis. In them, up to 80% of infections are subclinical, meaning there's no sign of infection. And unfortunately, this can cause the infection to go untreated for a long time. In lactating cattle, mastitis is the most economically significant disease producers face, costing them over $2 billion annually. It causes losses in multiple ways, like the loss of milk production, increased treatment causes, potentially teat blindness if the infection is bad enough, premature culling of productive dairy cattle, reduced reproductive performance, and most significantly, increased somatic cell count. For milk to be marketable, the somatic cell count in Georgia must be under 200,000. Mastitic infections in heifers, while not as commonly talked about, is an incredibly important topic. Heifers are the future of the operation and matter immensely on a large scale. Infections could compromise their productive abilities, their reproductive efficiency, and the longevity they have in the herd. To prevent heifer mastitis, many producers blanket treat their herds, meaning they use antibiotics, usually intramammary ones, on all of their animals. This is not only costly, but also labor-intensive, and means opening that naturally sealed teat canal. Unfortunately, a lot of people have hypothesized that opening that teat canal prior to calving can actually cause additional issues for the heifer, as there are additional chances for bacteria to reside inside the teat. As the population grows and as demand for dairy products, however, as we've seen, not necessarily fluid milk, many dairies have increased their herd sizes to maximize production and profit. So, heifer mastitis poses a threat to operations, as it is averaged that after her first lactation, meaning after her first time having a baby and producing milk, she has only really returned her investment costs. Because of this, scientists have attempted to discover ways to treat heifer mastitis without blanket treating the herds that can be effectively used across dairies. If we reduce the incidences of heifer mastitis, hopefully in your herd, it will hopefully reduce the incidences of future mastitis and of culling that heifer. Now, there are many different strategies to mastitis prevention and control. Firstly, a producer must be conscientious that the calves and heifers are provided with sanitary housing. They also must ensure that the heifers receive adequate nutrition and maybe possibly even vitamin supplementation, as loss in body condition has been related to mastitis. They also must have an economically viable and labor-implementable vaccination schedule, and they might also use prepartum antimicrobial therapy. A heifer is most susceptible to mastitis, especially if she has lost her natural keratin plug the later into gestation she gets. Additionally, conditions after birth, such as the retained placenta, endometriosis, dystocia, udder edema, and leaking teats can also cause an elevated risk for mastitis. Because there are so many instances when the heifer could contract mastitis, preventing mastitis in heifers is crucial. Scientists are always trying to find new ways to prevent intramammary infections, and recently there's been some speculation that administering teat sealant while heifers are caught up doing vaccinations or preg checks may reduce mastitic instances. The predominant research paper I viewed, Parker et al., studied the use of either teat sealant, injectable antibiotics, or both in pre-calving heifers. They enrolled 1,067 heifers and randomly assigned them to treatment groups. First, samples were collected from all the heifers' quarters. 268 heifers had all 4 teats infused with a teat sealant. 268 other heifers were injected with a vaccine of Tylosin base IM for 3 days at 24-hour intervals. 266 heifers received both treatments, and then 265 heifers were left as untreated controls. Through this research, they found that samples collected had a gland-level prevalence of pre-calving intramammary infections at 16.8%. The results of this study were that the use of the teat sealant reduced the risk of intramammary infection by 66%, reduced post-calving intramammary infection prevalence by 65%, and reduced the incidence of mastitis from any pathogen cultured by 74%. The Tylosin did not alter the cure proportion or prevalence or reduce any risk of mastitis. This may be because the dosage or the treatment methods, the researchers were unclear. Another study, Larson et al., found similar results as they studied the administration of internal teat sealant in pre-calved heifers to prevent intramammary infections. These researchers found that administering prepartum intramammary teat sealant made quarters 2.5 to 6.4 times less likely to be infected at calving. A third study I found, actually from here at UGA, Nickerson et al., found that using dry cow therapy, which are antibiotic infusions, Spectromast was used there, and a teat sealant reduced the rates of infection by 64% and prevented new infections by 92.2% and 97.9% respectively. The use of dry cow therapy, while expensive here, is incredibly effective at curing mastitis, and it looks like teat sealant is incredibly effective at preventing new infections. I believe that teat sealant could be coupled with intramammary antibiotics to cure mastitis, or simply be used more often as a preventative measure in heifer management to prevent mastitic infections. Now, of course, it depends on how the heifers are managed, stated by Fox et al., and variables such as housing location, breed, genetics, gestational stage, and others can affect the rates of mastitis and the rates of cure. Regardless, Parker et al.'s research is congruent with others that have researched teat sealant, such as Wolford et al. And Huxley et al., as ultimately they found that the risk of intramammary infection post-calving was reduced by teat sealant 48 to 84% altogether. So while the cure rates may depend on how the teat sealant is used, when it's administered, the animals that is administered to, and how those animals do later, I think it might be a good tool to incorporate for producers in their kind of toolbox of mastitis treatments for heifers. That way maybe we can eradicate some of the blanket treatments and hopefully use some non-antibiotic treatments.